once. I didn't really understand, but I said, it's okay. Let me just go be a part of it. I never know what will happen. So, and then we went to a certain room, and then we introduced ourselves. And then that's where my pay educator introduced this thing called NCDs. So I didn't really understand. First, I had so many questions in mind. I was like, what are these NCDs? Like, what are these? I've never even heard of them. And then he told us, just briefly, NCDs, these are non-communicable diseases. Like diseases that you cannot spread from one person to another. In maybe because there are examples like cancer, diabetes, obesity. You can't just spread them out. Like, I am here sitting with you, and then suddenly, maybe if I cough, you have the NCD that I also have. It's not like that. So
cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases. And sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll.
Welcome to the African NCD Champions podcast, where we meet people working in the non-communicable diseases space in Africa who are making a change. Today, we are joined by Shannel Lizz. Shannel Lizz is a young person from Mathare who has been working as part of the Young Health Program. She's both a beneficiary and a youth health advocate who has been working to improve health in her community and in her school. And today we'll be talking to her, aiming to learn something from her experiences, but also something from her journey as a health advocate. But before we go into all of that, let me give you a quick introduction to what the Young Health Program is. The Young Health Program is a program that is being implemented in Kenya through Plan International and funded by AstraZeneca. This is a program that focuses on improving the state of non-communicable diseases and sexual and reproductive health amongst young people. As we know, non-communicable diseases are the leading killer diseases globally, and their risk factors continue to affect populations not only in the global stage, but also in the global south. Countries like Kenya are affected, and we have high cases of tobacco smoking, alcohol use, physical inactivity, sedentary living, and unhealthy diets, which are some of the leading risk factors to non-communicable diseases. As part of the conversation today, Lizz will be sharing with us her insights, her stories, and experiences. And without further ado, Lizz, give us a quick, maybe not such a quick introduction to yourself, but an introduction to yourself, what your name is, what you do, and how we got here.
Okay, first of all, my name is Shannel Lizz. I am a daughter and a sister of 3 brothers. And I'm also a debater, motivational speaker. I'm an advocate, and I'm also a youth influencer. And as per me, the way I know myself, I know that I am bold, I am strong, and I am a sure girl. And I am a really strong girl from Excellent Care Center and School. And my school, both my school and my family, they have really worked hard to ensure that this girl that we are raising, is she going to be that girl that is going to stand out there for the children of Mathare? Is this girl going to be the star that will rise out of Mathare and prove the people that are out there wrong, that Mathare is not just a slum, but Mathare is a place where stars come out from, where beautiful flowers erect from that. We are standing up, and if most of the people have ever known this mystery, is that most of the successful people in this Kenya are from Mathare. Most of them, they're from Mathare. This is a true story, because they are from, most of the people, like the leaders that are out there, presidents, governors, all of them, they both have a story behind them. And you will I am very, very sure you will find out that these people came out from slums where they had no hope. And that living there gave them a motivation that they know that I must work hard for my life not to end here, for me to continue there and rise up out of Magdaline, to go out there and prove the people that are out there wrong. Yes.
Yeah, and I really like that introduction. That's a very, very nice introduction to yourself. And clearly, you are one of those flowers that are blooming out of Magdaline and that are set to really change the world.
Yeah.
Yeah. So I'll talk to you a little bit about yourself and how you ended up in the Young Health Program. So how did that happen?
Okay, at first we were in school, and then my peer educator, who is Calvin Jacob, but I refer to him as CJ. So we were with him, and I didn't know him at first. I didn't know what plan was, what was this Young Health Program. I didn't know anything about it. Like, I was from zero. So, and it was home time. I remember that day we were told to go home early because there was a youth program that was happening. And since we were so many in school, they couldn't engage everyone. They had to engage a few first. And then after the first are done, they will engage the second group of people. So then I was amongst them, but I really didn't know what was happening. So, and then our head teacher called me, and then he told me that, Shannel, there is this youth program that is happening, and I want you to be part of it. And by that time, I was in grade 5. I can remember very, very well. I was in grade 5. And since I wasn't that into youth programs, I didn't really understand, but I said, it's okay. Let me just go be a part of it. I never know what will happen. So, and then we went to a certain room, and then we introduced ourselves, and then that's where my peer educator introduced this thing called NCDs. So I didn't really understand. First, I had so many questions in mind. I was like, what are these NCDs? Like, what are these? I've never even heard of them. And then he told us, just briefly, NCDs, these are non-communicable diseases, like diseases that you cannot spread from one person to another. In maybe because there are examples like cancer, diabetes, obesity. You can't just spread them out. Like, I am here sitting with you, and then suddenly, maybe if I cough, you have the NCD that I also have. It's not like that. So then he explained it briefly and in a very simple way that even me myself, when I was that young, I still understood that NCDs are diseases that I cannot spread when we are in just physical contact. You can't just spread it like that. So, and then now, he also introduced something called risk factors. Like, these are factors that lead to this NCD. Some of them are physical inactivities, which lead to obesity. Some like unhealthy diet, which can lead to diabetes. And some like tobacco use and alcohol consumption, which can lead to cancer. So then after he explained everything briefly and in a simple way, I got to understand and I got to know that, oh, these are NCDs and this is what I should do to prevent them. He told us some of the preventions, some of the things that we can do in order to stay away and abstain from the non-communicable diseases. So, and then as time went by, when I reached grade 6, when I was in grade 6, our same peer educator came. But then, since I was considered to be the champion in school, so I was taken to be in all sessions. When the peer educator is not there, when he's there, I will still be in the sessions. When the peer educator was not there, I was considered to be that girl who was standing up, and we were briefly talking about what we were taught last time. So, and our sessions were on to every Thursdays, every Thursdays at exactly 3:10. We were in a hall, and then our programs will actually end at 4 or maybe 4:10 to 20. Maybe if there were activities in between, then we will have to extend the time. So then we had to do, I was there when the peer educator was not available. I was the one to be there. I was the one carrying his book and his chalks and maybe some of his stuff, that when he's not around, we can briefly just just touch on some things that you were supposed to do on that previous day, but then we didn't get to do them. So we'll just touch a little bit on them. And then in anything we don't understand, when he comes on the next week, we will refer to him. And then I reached into grade 7. And finally, I saw myself and I said, wow, this is really me. Like, I look at myself in the mirror and I say, you are a plant champion. And you are that girl that you can do anything in order for you to see yourself getting on top. And then, so when I was in grade 7, I did this thing called GTO, Girl Take Over, and it was really, really nice. And I had a very great experience because I got to take over, and now this is where it gave me that motivation to say, my life is not ending here. I am not living my dreams here. I have more dreams and I have more goals in future. I am not ending my life here. So when we went to take over, I had a certain girl called Precious. We were with her when we went to take over. So when we went there, in fact, this girl was telling me, I'm not getting pregnant this early. Like, I will not risk my life for any reason. I must be where these people are. Like, the person we were going to take over from, like, this guy was like, man, I was just like, my life is not ending here. I must work hard to become someone like him.
Yeah, and for the viewers watching, a takeover is when girls from, especially working with Plan Health International, I mean, take over various civil offices. So it could be the governor's office, the ambassador's office, the president's office even, and they go in there and they run the activities for the day. So who did you take over from, if you can remember?
Okay, so my memory is not clear, but if I can remember so well that she was a lady and she was I think, ambassador of the UNICEF company, something like that. And so we went to the US embassy, and that's where we took over from. And so when we got inside there, I was like, when I grow up, I want to be like her. I want to be that someone that people can look out for and say, like, this was my classmate. Like, I want a day that I am on television and then my classmates start saying, do you know this was my classmate?
Like, I know her.
Like, I know this girl. This girl was my classmate. Even when maybe I am out there and then there is a church member saying, we had this girl in church. This girl was a praise and worship leader. I know this girl. Even if you can't remember me, but still, your memory just hints that I know this girl from somewhere. And so she really motivated me to become that person that I would like someone to rely on me and say that this one is my mentor. This one is my role model. Like, this one, to me, this is like my angel. So when I'm here, in my mind, I'm just saying,
you have a target.
Yes, like, there is a dream and a goal that is out there that I would want to reach to, that I want to say that this one, I must get it.
I see.
And I will get it. Yes.
So how has the Young Health program, especially helped the health clubs in your school? I'm assuming there's a club in your school, and how has that engagement looked like?
Okay, so Young Health program, it has really, really empowered schools, mostly in Mathare. Like, I can say schools are really empowered by Plan International because, there are very various activities that learners go to, and then they're like, wow, so we should be doing this, we should not be doing that. So mostly, like, on the first activity that we did on Plan with our educator when I was in school was like, we were looking on tobacco use and alcohol consumption. And so our educator was explaining on the effects of tobacco, like it can lead to cancer, it can reduce your lifespan. So like on that day, so we didn't actually get samples of tobacco because it was not safe, because remember we were in school. So the only thing we did was we improvised tobaccos and alcohols. And then we had a short film that there are some people who are like pretending to be drunkards, some people are pretending to be like bad boys smoking. And then there were these now people who I was amongst them, like they were now the stars that came to say, like we were now that sunshine that was coming in and lighting up the whole world, saying that tobacco is not good for you. Like, so we came out there and started saying that you should not be using tobacco. Tobacco is not good for your health. Stop using alcohol. Remember, you are still below 18. Alcohol will not help you. Leave alcohol for the big guys. If you know, when as a person is using alcohol or tobacco, you know, they say that it is your role to help him change, but you only have only 20% of helping him to change, but the 80% is mostly on the person that you're trying to change. This person should be able to decide whether I am going to change or not. Am I really going to leave this thing? Or maybe I'm not. Because remember, as our educator used to put it, you are in a roundabout with somebody that is using tobacco or maybe alcohol. You're in that roundabout. And then you're trying to tell this person, go to this direction. But this guy is still saying, no, I don't want to go to this direction. But you are trying your best. You're telling, go to, even you put signs on the road, this direction, this side is not safe for you. But still the person doesn't listen. So it is now, when you have done your part, it's now for the person to do his or her part. He or she should decide whether I'm going to take this road or this road. It is him or her choice to decide which road I'm going to take or which path I'm going to take in. So Plan International has really helped members in our school. And I remember this short story that there was a guy in our class that was using tobacco when I was still in grade 6. He was using shisha pen. Like, it's a very common tobacco that is used in Madare because, you know, it's a slum, so anything that's available can be used. So it's called a shisha pen, and he came with it to school. At first I didn't realize it, but I had rumors saying that there's some people smoking in class. It was just rumors, but I really don't rely on rumors because I want something that I see for myself. I see it. I don't rely on hearing.
You can confirm.
Yeah, I see and I confirm that. I even become the evidence that this thing happened. Like, I'm there like the third party that this thing really happened. So then this boy was carrying shisha pens in school. They came first. We had backbenchers. We used to call them backbenchers, and it was just a group of boys. Like, they look like just bad boys. They weren't even concerned with education. They just went to school for the purpose of going. Just they can be seen that they went to school, but there's nothing they're doing. So they were using shisha pens. And the day I really saw, there was this boy that was new, and he didn't know how to use the shisha pen. I think he was just used to like stuff like Oris or maybe Supermart, the local ones, but he was not really used to using shisha pen, and he choked. So when he was coughing, I saw smoke from his mouth, and I was like, what is this? So when I went on to look in further, I saw that these guys were really smoking shisha pen, and you're in school. This is really insecure for you. And then I called our teacher, and then luckily that day was on a Thursday, so our educator came and introduced these guys to the program and said, like, come, let's do this together. We will help you. We didn't judge them. Even me, like, if you don't like to be judged, don't expect to judge someone else. Because the moment you judge me, I will also judge you. But even someone out there will judge you. Because you do. So, me, I usually say that do something for someone that you know, even you, when they do it to you, you'll be happy with it. Don't abuse someone, and you yourself, you know that I don't like being abused, and you're still going on an extent that you're abusing someone. Yeah, so if me, I don't like to be judged, I can't expect to judge you because I don't like to be judged, and I can't feel good when someone judges me. So our educator introduced them into the program, and some other guys who are using tobacco maybe secretly in schools from other classes, like in grade 8. By that time is when JSS was being introduced. So maybe they were in grade 8, they were using this tobacco. Maybe some were from junior secondary. He just introduced them calmly and said, we are not here to judge you. We are here to help you solve this problem. Because the main reason we are here is to help you to deal with your challenges and how you are going to face them and how you are going to walk through them. So when our educator introduced them to the program, so we were like, don't worry, we are going to help you. So, and then we continue the programs. And as per now, there are no cases of tobacco use in school. There are no, if there is a case, maybe it will be 0.00001% that is there's tobacco in school, but there is no. I am pretty sure. Like for now, I am an educational secretary in our school, and I'm really proud of that. So I have been checking on the classes and the programs that are in the classes, and there is nothing like tobacco use in schools. So Plan really helped at that point. And like if there was no Plan International, like even I know that most of the teachers, they didn't even know about this plan or the things that Plan do. So if Plan didn't exist, then for now it could be like there will be more and more cases of tobacco use, mostly in schools. So in that part, I congratulate Plan for helping us.
Yeah, they did well on that part.
They did a really good job, and I was really proud.
I see. So second to last question, and again basing on your experience. So maybe I'll put it in a two-part way. So the first part is, how else have you seen that the Young Health program has helped you? As a student, as a peer educator, as an individual, and you'll finish that question with what are some of the recommendations do you want to share as a member of the health club in your school that you as a beneficiary to the program. So how else has the program helped you as a person, and what recommendations can you give to others, to the public, to other people supporting these types of programs as well?
Okay, so Plan International has helped me personally, like really helped me, because when I take an example with Madare, that place is like slum, like there are drugs everywhere, there are cases everywhere, like there's no day that can pass without hearing that there was a robbery somewhere in Madare, or maybe there was a fire case somewhere, there was a murder somewhere in Madare. But so Plan actually came as the light at the end of the tunnel for Madare. Like in Madare, it was darkness. Pure darkness, like you couldn't see your way through. Like when you go to this path, something is hitting you. You go to the other way, something is hitting you. Like we were in the dark. But Plan International came and was like the light at the end of the tunnel for the people of Madare, and as for me as an individual. So me as an individual, I felt like Plan International helped me to boost my dreams, helped me to have even more dreams and goals and visions for my future. Like when you're in Madare, you'll see like there's no hope in Madare. Most of the people think that there's nothing good that can come out of Madare. So when Plan International came, and as I said earlier about my girls take over, like the GTO staff, when I went to take over, is when I realized that there is a life out here. Like there is a really good life out here, and I have to work hard for it. So in that part, Plan actually motivated me to go on for the future. And as per me, I used to determine my future by what happened on the past. So I would like say, but when I was still young, we don't have money, we are poor. So I would actually say that if my family is poor, who am I to become rich? So I was determining my future by looking at my past.
At the past.
So, but when Plan International came, there was this quote that I used to work with, that your future don't determine what happened in your past.
Yeah, your past doesn't determine your future.
Yeah, that one. Yes, so I was like, when I want to work hard, and I don't want to live this life that my mom is living right now. I don't want to become that person that my mom like even when my mom sees me, she's saying as if she has wasted money on me. Instead of that money, maybe opening a business or doing something good with her life. So I wouldn't want to be like that kind of a girl who gets pregnant suddenly and doesn't finish school. So Plan International really, Plan really pushed me to tell me that, young girl, this is not where life ends. There is a good life out there.
And
work hard to deserve that life. Just work hard, continue with your studies. Don't engage yourself in some useless activities that will not help you academically. So you just go on and work hard and to become a successful woman that even when you stand in front of people, people will respect you and bow down and say that this one is my role model. I want to be like her. So that Plan International really it motivated me academically and like individually, like as I am. It's really motivated me. And even today, I have mentors that are engaged in Plan International. I have psychologists that are engaged in Plan International. That whenever I have a problem, I have a problem, I will go to them and ask them, how do I do this? Because I think I am tired of life, and then they'll tell me, no, you can't be tired. Just continue. Your journey is still long. You still have paths to pass through. Yeah. So as for me, Plan International really motivated me.
Yeah, the last question that I asked before. Recommendations.
Okay.
3 recommendations.
Okay. First, I would like to say thank you to Plan International as a whole of how they have helped children in Mathare. Because there's that child in Mathare that will say, my mom can't afford a healthy diet. Like the only thing we can be eating is maybe, even some families in Mathare, like even some schools, like they can't really afford a healthy diet. Maybe a healthy diet can consist of all the nutrients, like the vitamins, carbohydrates, proteins, and maybe fats and oils, because most of the children and families and schools in Mathare can't really afford them. But when Plan International came, they came with, let me just say, blessings. Maybe they were angels sent by God to come and rescue the people of Mathare. Because when they came, the moment Plan International got in is when I think there was this production of healthy diets that were introduced to schools, and these schools, they finally got a diet like after eating, children will be given fruits like maybe bananas or oranges, like to make it a healthy diet. Like the meals in schools will actually comprise of the vitamins, the proteins, carbohydrates, and everything. So they will, but before Plan International even existed, children were suffering, because you'll find that there is that poor mom out there that can't even afford lunch for the children. And at that time, you find that the school doesn't even have feeding programs. Now, when the children come back home, they will have nothing to eat but just drink water and go back to school. But when Plan International came, they came as that light, as I said, the light at the end of the tunnel for Mathare. And like the children of Mathare, they started now being those bold and strong people that said, when I grow up, I want to help people like the way I've been helped today. So Plan International, I would like just to say a very big thank you, and I would like to say congratulations for the good work that they are doing, because they are really pushing families out there, like they're empowering people out there, youths out there. They're like the youths are being motivated, and they're like, wow, one day I want to be like him or her. Yeah, so I would really like to give a thanks to Plan International as a whole, like with the all young health program staff, there's AstraZeneca. So it's a really congratulations to you. And then for the sponsors that are sponsoring Plan International as a whole, like they should not give up. Like they should just continue to strengthen those children that are out there, because they are our only hope. Like Plan is the only hope for Mathare, because when Plan International comes, there are these youth programs that mostly when the schools are closed, like young people, like at my age, we go to mentee stuff, like you get to choose a mentor, you get to talk to him or her on your problems. So yeah, and I would like I would just like to say, Plan International should not give up on us because you're our only hope. And I know that one day, all the people that has been helping Plan International, one day they will stand up and say, my only hope was Plan, but now I want to become a part of them. I also want to become a hope for somebody out there. Yeah, so I would like to tell them not to ever give up and just keep on supporting us because we are there, we are all alone. Like, we see ourselves like we were stuck in between walls, but then when you came, now the doors started opening. Like, you see a door is appearing on this way, another door is appearing. Like, we open up the doors and then we see bright futures for ourselves. Yeah, so I don't think I have any much more to say, but I would just like to say thank you to Plan, and they're really my motivators. And from everyone that's watching out there, don't lose hope in life, because the moment you lose hope and say you cannot do it, then that's where your dreams and your goals will crash. So never give up and don't lose hope in life. I know I am still young, but still I can motivate that someone that's out there. Like, do not give up. Just continue with your goals and dreams. I know obstacles and challenges are there, but there is one or another way that you will get past through them, and you'll become that person that when you stand up, people will say, I want to be like that one.
Yeah, and thank you very much for those very nice closing remarks. I think a lot has been said and really goes to show how much the program had in terms of its impact in the community, with real examples, like actual people who benefited from the program. And that brings us to a wrap for this episode, and we are looking forward to having you on the next conversation. And again, thank you very much for being here, and we'll see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.